Hi folks, welcome to my YouTube channel. So today we will continue our discussion on the varicella zoster virus. So now we will discuss about the immunization. So currently for the varicella zoster virus, a live attenuated vaccine is available and according to the current schedule that there are two doses to be given for this virus. So the first dose is indicated at 12 months through 15 months old and the second dose is indicated from 4 years through 6 years old. As this vaccine is a live attenuated or a modified type of a vaccine, so there are some contraindications and the precautions keep in the mind before giving injection to the any patient. So the contraindication includes severe allergic reaction such as anaphylactic reaction to a previous dose of a varicella vaccine or any type of a severe allergic reactions related to the neomycin or the gelatin because these two if the person has the allergic reaction to these two then they will show a severe type of allergic reactions to the varicella vaccine as well because they both share the similar components and if the patient is the pregnant or the patient or the female patient trying to become pregnant near soon or any patient who has the hematologic and solid tumors or the person is receiving the chemotherapy for those type of the tumors or any person who has the congenital or acquired T cell lymphocytes immunodeficiency or the person has the active HIV infection. These all contraindication includes if the person is immunocompromised because as the vaccine is the live modified type of a vaccine so when given to the immunocompromised patients, the virus can reactivate and the virus can gives rise to the varicella infection itself. So discussing about the adverse effects of the virus, there can be some localized and there can be some systematic type of the adverse effects. So the localized includes complaint of pain, tenderness, or the redness at the site of injection, and other includes fever and the febrile seizures and in some patients who are immunocompromised, severely immunocompromised, the virus can activate and gives rise to the disseminated varicella and the meningitis, but they are very, very rare. And the fourth adverse effect, which is very significant, is the development of the rash. Even though it can occur only in 1 to 3% of the patient who receive the varicella vaccine, can develop a localized rash, which commonly includes 2 to 5 lesions in the injection site and another 3 to 5% develop a generalized varicella like a rash. But the importance of development of the rash is that any person who develop the rash after the vaccination always needs an extensive evaluation because there are three possibilities this rash can present and the two important components are keep in mind to differentiate all these categories from one another. And finally, it is the PCR test who will make a clear verdict about uh, the rash is either caused by one of those three categories. So the two important features clinically to keep in mind to differentiate the three different type of the rashes which can occur in a vaccine recipient. The first is the time interval since the receipt of the varicella vaccine and the second is the severity of a chickenpox illness. So the first category of the rash includes a wild type chickenpox or a typical chickenpox which we discussed in our first video. So it represents as a generalized rash which average 200 to 400 lesions. Of out of those lesions, mainly the lesions are vesicular type of the lesions, and the prodrome of the fever and the cough is present. And these type of the patients are highly infectious. They need to be quarantined. They need to be isolated from the general community, and they become non-infectious once their vesicular lesions dry off or the crusted over, especially after the 5 days of the rash in onset. So typically they can occur in two events when the person have the vaccine. So either it is less than 1 week post vaccination, it means exposure to a wild type of virus which happens immediately following the vaccination. It means there hasn't been sufficient time for the immunity or the body to develop a antibodies against the uh, virus. And the second category includes the 6 weeks post vaccination. It means there has been completely or the total failure of the vaccine, and the person has developed a wild type of a chickenpox acquiring from any person who has the chickenpox. But developing the total failure of a vaccine is a very rare event. And the second effect is the vaccine induced rash, which commonly occurs in 1 to 5% of the vaccine recipients, and typically time interval is 1 to 3 weeks, but it can goes up to 6 weeks post vaccination. And if the person commonly the person have a localized type of the rashes, but if in case the person develop a generalized rash, those are mostly maculopapular. Unlike the wild type, though in those the lesions are 200 to 400 and mainly vesicular, but in the vaccine induced they are mostly maculopapular. And in terms of number, they can be less than 20 or can goes up to the 50. And most of the patients do not develop any prodrome. They are afebrile and no septum, or they are completely asymptomatic. And the most important thing about this is if the person develop a rash and it has been determined that the rash was developed because of the vaccine, then these persons do not need to be isolated. They are totally non-infectious type of lesions. And the third is the breakthrough chickenpox, which is also known as vaccine modified chickenpox. Breakthrough chickenpox occurs when a person typically acquire an infection which is a wild type of infection, but the vaccine has produced its effect, so the person will have a partial type of immunity. So the person will have a infection, but the severity will be much lesser compared to the wild type. It commonly occurs after 6 weeks post vaccination, and the clinical presentation is the generalized rash, which contains less than 50 lesions, mostly are maculopapular with few vesicles. So this picture can completely mimic with the vaccine induced rash, but the most important thing to differentiate either is a breakthrough or it is a vaccine induced on the basis of clinically and on the basis of PCR, because the breakthrough chickenpox is highly contagious and the patient should be isolated or the quarantine from the general community, because the person can uh, transmit the virus to the general community. So these are the clinical features to make a judgment from the wild type to the vaccine induced and to the breakthrough chickenpox. And ultimately, after clinical suspicious, PCR is a highly sensitive and a specific test to differentiate all three categories. So this is the end of my video. Thank you so much.